Hey y'all, my name is Yusra Iftikhar. I use she, her pronouns, and I am your APTA Students Director of Communications. Welcome to my last solo APTA Live student night. And on the next one, I'll be joined by the incoming Director of Communications. So if you're a student APTA member, please be sure to go vote for your next Student Assembly Board of Directors, and you can do that now online. Speaking of being a student, introduce yourself down in the comments if you're watching live. Let us know if you're a student, new grad, PT, PTA, or anyone else and where you're joining us from. I am very excited about tonight's topic. We're talking about a lot of things: body image, body dysmorphia, pelvic health, mental health, yoga, and how all of that relates to physical therapy, education, and practice. It is my pleasure to introduce our guests for tonight. We've got Christina Holland and Ivana Salazar. Ivana, pronounce your last name for me. Did I say that right?
Salazar.
Okay, Salazar Fryer. You also got married, so congrats on that as well. All right, welcome to the show. It is so good to have you here. I've never gotten so many messages saying how excited people were to hear from you both. So if you don't mind just introducing yourselves to the audience. Ivana, we'll start with you, and then Christina.
So I am Ivana Salazar Fryer. I'm a PTA in Louisville, Kentucky. I'm currently working for a company called Results Physiotherapy, doing orthopedic and pelvic health. And I also am a yoga instructor.
And I'm Christina. Oh, sorry, Yusra. I'm Christina, and I am in Denver, Colorado. And I split my time at a local nonprofit hospital and also for my own private practice, inclusive care.
All right. So I think it could be really helpful for everyone to hear about your practice, what types of patients you're working with on a day-to-day, just so we can kind of set the stage for everything going forward. So Ivana, if you don't mind telling the group, what does your patient demographic look like? What led you to be in that setting, and anything else that you think we should know?
So here in Louisville, I'm actually a float now. So I go to all of our Louisville locations doing ortho and pelvic. So different parts of the city really just brings on much different clientele. So I have my rural folk and my urban folk, and it keeps it really interesting and busy. I'm originally from West Virginia, and both of my parents are physical therapists, so I kind of don't know how to do a lot of anything else. But they graduated from a small school in Maine. So kind of bringing in a lot of different backgrounds and education, and I did home health for quite some time. But I wanted to have the opportunity to kind of see what came next. So I had a lot of clientele, and I got them back from, post-op or acute care, and I got them back into their normal living routines safely, but then that was it. So getting people to get to a place in their lives where they can go back to the activities that they thoroughly enjoyed or get to do something that they haven't been able to do in a very long time was something that I wanted to give a try. So here we are.
Yeah. And real quick, so you're not currently teaching yoga, correct?
No,
but when you did teach, how long did you teach for, and what did that setting look like?
So taught yoga for about 5 years. The past 5 years, took a break about a year and a half ago, and then, the world exploded. So I'm not teaching it in the studio right now. But taught several different clientele, and I do have certifications in Hatha yoga, which is more of like a freestyle kind of yoga encompassing any of the styles that you really choose, and also Shaya yoga. So it's a rehabilitation based and very physical fundamentals. So working towards getting my certification in yoga therapy after that. So kind of not only just for general health and wellness, but also for injury prevention or rehabilitation, and using yoga as a way to do that. So
yeah, absolutely. That's what an amazing kind of combination of like your two interests too. I love that. Christina, what about you?
Yeah, so I work at the hospital that I work at. It's a nonprofit community safety net hospital. So we see a lot of people who have Medicaid insurance, which has been really awesome. So I see some people from a rural community, but not like Ivana. We do have people who travel into the city for pelvic floor physical therapy because there is not a lot of access elsewhere, especially for people who have Medicaid. We also have an integrative pelvic health team. So I'm part of a couple different teams. I'm part of an integrative pelvic health team. So there are 8 different types of providers, and we meet once a month to discuss complex cases, all for people who are having complex chronic pelvic pain. And I'm also part of a team that is postoperative vaginoplasty. So I see trans women after bottom surgery and help them use dilators to be able to use their pelvic floor, their genitals, for whatever they would like to. And then I'm also part of I see postpartum and pregnant folks in the women's care clinic. And then I also am in outpatient PT. So kind of a big mix. And then in my private practice, I'm all private pay. So I don't contract with any insurance companies. And so I primarily it's still sort of a mix. I see a lot of people who are having dyspareunia or painful intercourse and chronic pelvic pain.
Okay. Yeah. So really, really diverse group of people there that both of you are saying. So I think that's really great. So I'm guessing that brings up a lot of different things for a lot of different people. So even a topic like body image, if we focus on that one thing, that probably presents in so many different ways, not just among your patients, but probably among your colleagues, maybe in yourself. If you're comfortable sharing, do either of you have a history with body image issues? Is that something that you ever deal with? And has that come into play maybe when you were a student or now that you're a provider?
Sure. I mean, I feel like as growing up as a cis young woman to then become a cis woman, there's a lot of pressure put on cisgender women. And certainly from my own experience, I've absolutely struggled with, appearances and basically what I anticipated that my body should look like versus what it actually looked like. Which then becomes extra interesting when you add in injuries, right? And things that are going to impact your general lifestyle, or a pandemic where you don't have access to gyms or, anything like that, that's going to throw a wrench in basically what you do to keep your body looking the way that you might want it to look.
Right. Yeah, absolutely.
Yeah. I mean, I feel like who doesn't, at one point or another, and it doesn't have to be an extreme, but it's hard to be a woman. I mean, there's a reason why not everybody can do it. So it's just, when do you not have that day where you put on your jeans and they feel a little bit tighter, and you see somebody, then you're just like, damn, I love her hair, and you just feel a little bit tweaked for a second. We all have that.
Yeah, no, I totally hear that. That makes me think of, just because I want to make sure I share too. It's not fair if I don't, but I remember last APTA Live, I texted my APTA mentor halfway through being like, oh my God, is my face always that crooked and lopsided, while my guest was talking to me. So it seems like these things come up a lot. But I'm interested in hearing your thoughts then on why sometimes this becomes a taboo topic. I was thinking about this a lot all day, about how for me, body image is something that is always on my mind, whether I'm eating, exercising, sleeping, relaxing with family, I'm always thinking about body image. So for me, it makes sense that there's overlap with physical therapy and what I do. But for someone for whom that's not a huge issue, and they're like, well, this isn't PT, or how many things could we possibly juggle? What would you say to those people? How has this come up in your practice, I guess?
It comes up in my practice all the time, especially working with transgender folks or gender non-binary folks, because there's so many levels. And so for a lot of my patients who are gender non-conforming or were born into a body that doesn't feel like theirs, body image is extra complicated. And how do you differentiate what is a body image issue and what is dysphoria? And also for a little bit added of a just mind-blowing moment, what would happen if we removed a lot of the ideas that we have about what bodies are supposed to look like for certain genders, and who would still feel dysphoria and who wouldn't? I think is just a really interesting idea. And then I think part of the reason that we don't talk about it as a professional all the time is I think I listened to my colleagues speak and my classmates when I was in school, and I think a lot of us have some internalized body image stuff
Mhm.
that isn't that like I think we rationally know it comes from a place that isn't rational, like is internalized patriarchy a lot of the time, white supremacy some of the time. And so just figuring out what to do with that information when we feel like, oh, but regardless of what my rational brain knows, like I should feel differently about this.
Sure. I want to follow up too. So, do you try to tell a difference between body image issue and dysphoria, or is that something that you maybe work closely with other providers to help patients work through?
I let people tell me what they think it is if they bring it up.
Okay.
So
Okay.
however someone self-identifies it, I just let it stand with that. It doesn't very much matter to me either way. We just move along in whatever way feels comfortable for them.
Sure. Yeah. Ivana, did you want to add anything on like taboo topics and why that might be?
So I think that one of the things that I notice, especially just in outpatient ortho, is it's funny to me how people just assume so much that you have your entire life together. You're working on people that are in pain or they're having an injury and things like that. And I get asked how many times a day, like, oh, and can you go work out after this? Or, oh, you don't know what it's like to have pain. And, oh, if you only
Mm,
knew. And it kind of puts you in a position where you're just like, I'm also a human. And
sure.
I'm educating you and I'm trying to help you, but at the same time, I have aches and pains, and lifting your leg is not the funnest thing for me to do right now, and that's okay. But it took me personally, it took me a while to kind of just from work. We have everything else in the outside world, but just in work with realizing I don't have everything together, and I would used to feel bad when people would kind of point that out to me. And then I'm like, I should do more. And how can I be teaching you if I'm not doing the same? And while I think
Mm,
that that's very important, I'm also like, no, my back does hurt today. And that's okay. And I
right.
don't have to feel
Absolutely.
bad that you have pain and so do I. And here we are together and we can get through this together. And I don't think that it's not, or it's taboo, I guess, is the word that we're going to be using now. It's not taboo to kind of minimalize yourself to comfort somebody else's idea, or
Mm.
give into their thoughts of how they should be feeling, and to take the brunt of all of that onto yourself.
Right, right. And I think too, so Ivana, we know each other because I worked with you at my first clinical rotation. I was a student at Results in Louisville. And I remember for me, like I said, body image is something I'm thinking about all the time. So it's really common for me to go into a space and feel like, oh, I'm the biggest one here. Oh, I don't belong. Or, oh my gosh, I'm going to be a terrible therapist because I'm the biggest one here. And I remember how powerful it was for me to see kind of early in the morning, like you and our other coworkers, like working on each other and like helping each other out, and like talking very openly about like what's bothering you and everything that's going on. And I loved how comfortable I was. I mean, you know how much I love that rotation and just loved being there. And I love that openness, I feel like, is what made me feel like I belong. So, kind of why wouldn't that also be the case maybe for patients too? So I always just really appreciated that. With both of you being in pelvic health in some capacity, working with patients with pelvic health concerns, do you find that body image concerns seem to come up more with those patients, or is it just kind of across the board? Christina, we'll start with you and then go to
I think so.
Ivana. Yeah.
Yeah. So it comes up a lot, right? Because I have to talk to people about not sucking their stomachs in all the time, because when we do that, TA activates, which can activate pelvic floor because they're co-contractors. And so now all of a sudden, if you have persistent pelvic pain, and you're adding in this like, oh my gosh, I have to be as small as humanly possible, and I couldn't possibly let my stomach out, it is definitely impactful in people's care.
Sure, yeah. Ivana, what do you think?
I mean, I 100% agree with that. I think that teaching diaphragmatic breathing is something that is much harder than you would anticipate it to be, because you have to let go of that tension in your core, and you have to let yourself be a little lax and be a little bit bigger than you might feel comfortable being for just a moment. And that's difficult for people to wrap their head around. But also, I feel that you know, when women have the courage to come forward and say that they have an issue in something that is not really a comfortable topic to speak of, they feel a little less than, either, like you said, after just having a baby, or maybe they're just having an issue that they seem to feel is a little bit embarrassing to them. And so, absolutely, I feel like I get a lot more of those heart-to-heart moments with my pelvic patients than I do my ortho, for sure.
Sure. And so thinking about those patients in which either they bring up something or where you feel like there might be some component of like they're uncomfortable kind of being on display, like out in the clinic, for example. How do you bring up potentially sensitive topics with patients if they don't bring it up first? Do you, or do you wait for them to feel comfortable enough to open up if you feel like it's impacting their care and their treatment?
I'll normally bring it up. A lot of these things really lend themselves to me to be pretty easy to discuss in terms of this is a systemic problem. It's not a problem with you personally. Because we can recognize that lots of cisgender women and lots of trans women and lots of trans folks and non-binary folks and frankly, lots of cisgender men as well, although I think that's much less discussed, have body image concerns. And now that it's a cultural narrative that we're at least aware of, I'm pretty we'll just throw it out there. I'm like, yeah. And so, you know, lots of people spend a lot of time with their stomach sucked in because of patriarchy. And I will just call it like it is in the clinic, and people will either agree and like nod along, and I'm like, okay, we're here, or they don't, and it's fine either way.
Yeah.
I want you to breathe into your belly regardless of why you think you're clenching your stomach.
Right.
Yeah, I definitely bring it up because you're here to feel better and I'm here to help you get there. And so if I kind of sweep it under the rug and let you get by with it, then I'm not doing you any favors. So this is a safe space. Let's talk about it.
Yeah. And both of you have got some experience. So for those of us who are students or new grads, are there any like hints that you can pick up on in people that you think, oh, this might be a component of why they may be uncomfortable, why they might not be opening up, why the exercises might not be going as well? Or is it just too variable person to person?
That comment made me think too about dysphoria. Sorry, just back one quick question about things I don't talk about is I do not bring up dysphoria in people because I don't know if I don't want to assume that people who are living the trans experience have dysphoria, because not all people do. And certainly non-trans people can also have dysphoria. So I don't ask questions about that. I will leave room and like, maybe we'll talk about, because I certainly want to know if people are wearing binders, for example, or if they're tucking or things like that. And so then we might talk about those things, but I won't ask direct questions about dysphoria. And I don't really ask direct questions about the way people feel about their bodies. I just kind of speak like we're talking about, like we're assuming that people are holding a lot of tension in their abdomen. And I will often ask people like, do you find yourself clenching your stomach throughout your day? Is that related to, do you have anything that you know that that's related to? And I think in terms of what you can look for in the clinic is, what are people's breathing patterns? Are people letting their stomachs go if you're trying to do diaphragmatic breathing specifically, or if you're doing pull downs with straight arms, or if you're doing some type of squat, like what are people's breathing patterns looking like? And then I also ask a lot of questions about leaking, which is easier because I'm a pelvic floor physical therapist. But even when I was ortho, it was something that I talked about a lot because tons of people are leaking and just it never gets asked. So no one ever says, oh yeah, that's me. And when that's happening, oftentimes, especially if it's during higher level activity, it's because of it's a pressure mismanagement thing, right? So that's another thing good to ask about, and then might indicate to you that something's going on.
Yeah, perfect. Ivana, anything to add? It's okay if not.
I mean, looking at people's body mechanic, or, you know, how they hold themselves. And a lot of times I kind of always keep my ears open to comments or little jokes and things like that. And I find that keeping my personality light in the clinic is always very important because I want people to feel comfortable, but I also, you know, if we can make light out of something that maybe you find or feel is a little bit embarrassing, then you might be a little more comfortable talking to me about it. But at the same time, if I notice they're constantly making comments about, I'm so big, I might roll off the table, or I can't do that, or my big belly, or this, that, and the other. And then, like, let's kind of like tone it down a second and talk about how what is safe for your body and what your body needs right now, and what's maybe not giving your body a fighting chance at this, and kind of put it in terms that make them feel that it's okay to be a little out of your comfort zone.
Sure, yeah. I love how you phrase that too of there's so many things in a physical therapy practice that are going to put patients out of their comfort zone, and we can argue that that's what you need for growth, for recovery, for healing, right? And so this is kind of just one of those things. So instead of a patient saying, "Oh gosh, I can't do that, I'm so fat," and you immediately saying, "Oh no, you're not," or the classic like, "No, you're not, you're beautiful," right? Which there's so many problems inherently with that as well. I love that it's, well, let's think about what you truly need to feel better. Like, you're here for a purpose. I'm here to help you, and like, I'm here to help every person. Doesn't matter, what you look like. I just want you to feel better. And I'm sure the patients want that too. So I really love that framing of it as well. Christina, you talked a lot about working with trans patients, and I was wondering if at all how your language has changed around body image and kind of your attentiveness to a person's body image since you started working with trans patients.
That's an interesting question. I don't think I spend a lot more time thinking about their body image necessarily. I do think that what it did make me more aware of is, we're constantly in physical therapy talking about the nervous system and how lots of our interventions are helping to make people's nervous systems feel safe. And so when I started treating transgender and gender nonconforming folks, it was like, oh, something that might be making their nervous system feel safe is feeling like they're in a body that doesn't feel familiar or doesn't feel safe. Like their body might not feel safe to them, which did change the way that I spoke about bodies in general. So I'm very hesitant to use any sort of like gendered language, even around pelvises, which is arguably the most gendered language that we have. And so it's kind of, I guess, indirectly in that way, I guess you could say that I do think about body image more, but I didn't really perceive it that way. That's not how I had internalized it.
Yeah, that definitely makes sense. And Ivana, kind of on the same train of thought there, in your yoga practice, did you notice once you started teaching yoga, or whichever one came second, whether it was your job as a PTA or your job as a yoga instructor, whichever one you went into second, did you notice any shift in the way that you talk about bodies, movement, and exercise?
Absolutely. I mean, I taught yoga first. Again, I was, I've been surrounded by physical therapy my entire life, but it's the terminology that you use is very different. When you're in the clinic and you're telling somebody to move their foot a certain way, you're not going to say to shine your foot to the right or anything like that. So using those terms definitely, but I think that I probably bring in some yoga terminology into the clinic a lot more frequently than people realize that I do. Just to make sense of it. And you can use your big words, and you can use your anatomy lingo, and you can use all of these things all day long, and somebody's probably going to look at you like you have three heads at some point. So sometimes explaining a stretch in a couple different ways might make sense to them, and it might allow them to have a click moment. And I think that having that in my back pocket definitely helps out. But I think the biggest thing that I bring to when I leave the mat and I come into my PT world is sequence. I pick sources of movement that I think would work for them, and I pick them in a way that I think would work for them. And then I come up with ways that they can do that at home, and then they can realize this is a far more feasible thing for me to do than I originally thought. And it seems a lot less intimidating when you go home and you're sitting at your desk, when you don't have a weight machine next to you, or giant Swiss balls of many colors, and you can figure out this is the same movement and my body's going to move the same. I just have to figure out the way that works best for my body to move. So
yeah,
I use
absolutely.
both.
Yeah. So I do stay on this topic of language for a second. So I had a question come in from my Instagram community asking, well, how should we respond if patients say something about gaining like the COVID-19, basically gaining weight during this time of COVID? A lot of us are quarantined, and some people may have gained weight. One, have you heard that at all? And how would you, advise addressing it? And two, I guess, do you talk about like BMI with patients? Do you weigh patients when they come into the clinic? Is weight something that you focus on at all, or not so much?
I don't talk about weight at all. Like I don't ever bring it up. In our clinic, we have, so if you were going to see a provider and they might ask you, would you like to be weighed today? Which I personally love. I then also went and was seen in my clinic, and they needed to weigh me because it was my first appointment with a PCP. But they didn't mention anything. They didn't tell me the numbers. They didn't make me look at it. They just I just kind of diverted my attention and my eyes because it wasn't something that I wanted to spend time in my brain with today. And then they wrote it down and we moved right along. So I don't talk about it. Certainly it comes up. Yes, lots of people are very uncomfortable with the weight gain that's been happening. And I just try and reframe it for people. And it's the same thing that I'm trying to do for myself. I'm trying to reframe it for myself too, to be frank. And it's like, all right, yeah, so this body might be heavier than it was before. And also it's getting me through a pandemic and just like a completely bonkers and stressful election cycle. And also like allowing me, it's a vessel for all the things that I'm doing. And if I have to buy new pants, I have to buy new pants.
Right.
When you say some people, say I am some people who hasn't gained weight right now. Like, let's just be real honest. But I mean, it's just, I feel like weight is such a touchy subject, and the idea of BMI just makes my brain hurt because like that's not what this test was designed for. So you just need to, like shove it. I don't want to talk about it. But just like what you were saying, Christina, I mean, here's the bottom line is your body is incredible. And everybody that is listening to this and everybody that will be watching this later on, you have all made a very conscious effort to study and appreciate the human body. You decided to dedicate your life to studying and appreciating the human body. And so stop being so mean to it. You wouldn't do that to your phone. You wouldn't do it to your car. I see people treat their phones better than they do themselves. So your body works so hard for you, and it gets you up every day. It gets you moving. It puts that cheeseburger in your mouth, and it's going to walk it off later on. It does all of these things without question, without hesitation, and all you're giving it back is negativity. So you wouldn't do it to something else in your life if you wanted it to work. Stop doing it to yourself. Stop being so mean.
It's crazy. Thanks oh my gosh.
That was the pep talk I needed. Thank you.
I know. Same. I was going to say, what a mic drop. Okay. Well, honestly, that was amazing.
BMI gets me heated. It gets me heated.
Well, my next question was going to be, what do you think about BMI as a marker for health? But I feel like I know where Ivana stands.
Yeah, I'm going to go with garbage. It's going to be the
word. It comes up. I think the only reason I even think about BMI is because, well, one, it's in my EMR, especially when I'm at the hospital. And I really only think about it in terms of surgical outcomes, because sometimes, especially again, in the transgender community, if people want gender affirming surgery, or frankly, honestly, if people want total hip replacements, they do look at BMI, right? So they're predictive, they're using BMI to predict outcomes. And decide whether or not people can have a surgery. So when you're talking about I don't like talking about weight and I don't ever bring it up. But people, not only in relation to COVID, people will bring it up because they're like, well, I have to lose the weight to get the surgery that I need. Right. So that's a whole thing that I have to address, right? We have to talk about it. And I try and just keep it as neutral as possible, as weight neutral as possible. You're not a better person because if you lose this 25 pounds, you are just a person who then gets to have the total hip surgery that you want if you lose these 25 pounds. And sometimes it comes up with prolapse and things. And sometimes what I really try to redirect is when people are like, well, I know that if I lost weight, I wouldn't have pain. And that's a discussion that we have pretty frequently in terms of, okay, well, we don't actually have any data to suggest that if you were thin, you wouldn't have pain. And also I see lots of fat people who have no pain at all. Or rather, maybe I don't see them because probably if they don't have pain, they're not in my office. But I know lots of people of all sorts of weights that do not have any pain. And so I always try and reframe that because I think that can be something that drives people's nervous system into that kind of upregulated state.
Absolutely. And I have a follow-up question for you about that and about social media and TikTok. But first, I want to take just a quick break to do a couple of announcements. All right, everyone. First of all, thank you for tuning in tonight. Registration for APTA National Student Conclave is open now. The APTA student member social media pages, Instagram in particular, has some really great information on NSC registration, what it means to attend NSC virtually, and stories from past attendees on their experiences and what they got out of NSC. And if you are like me, like the first couple years of PT school and have no idea what NSC even is, the social media pages are really great for that as well. So NSC is happening this year on November 4th through 8th. So it's coming up very soon. At NSC, also, there's going to be my current student assembly board of directors to the next one. So you can vote right now in elections. If you're a student and an APTA member, you just go online for that, enter in your APTA number, and you can vote for your next student assembly board of directors. And they've got candidate statements up there. They've got videos up there. I highly recommend you check those out. I've been amazed by how great virtual conferences seem to be going for me, honestly, but I also think that it is hard losing out on that in-person factor of getting to know the candidates. And so they have worked very, very hard on putting together these videos and these candidate statements so that you can get to know them as best as possible in a virtual format. So please do check those out. Talking a little bit more about NSC, just some of the events and discussion I'm looking forward to at NSC this year include my own. I'll be on a panel with my friends, Student Assembly Board of Directors Secretary Alex Flynn, Duke DPT third years Alexis Lacewell and Sarah Bellin, and physical therapist Michael Cromartie, who you might remember from the June APTA Live. We'll be discussing fostering allyship and diversity, equity, and inclusion, and bringing up some of the topics that we're talking about here as well. Some more sessions to look out for include entrepreneurship in physical therapy and thinking beyond patient care on Thursday, November 5th. That's a live one. A live panel on Special Olympics and inclusive health and fitness from both health professionals and athletes on Friday, November 6th. There are going to be networking breakout rooms on multiple nights with students and new grads on topics like excelling in your clinical rotations, pursuing residency, and avoiding burnout. Additionally, there are some really solid on-demand sessions, meaning those are not live, so you can access them anytime the week of NSC, and I believe you can access them for the rest of the year, though someone correct me if I'm wrong. There's one on House of Delegates with my classmate and URSBT delegate, Mitch Lane, and Vice Speaker of the House, Kyle Covington. There's a session on Travel Physical Therapy 101, PT careers in the military, adaptive sports, physical therapy in the emergency department, and so much more. If you follow me on Twitter, you probably saw that I said the sessions I'm looking forward to most at NSC are all of them. There's a really great lineup coming up. So very, very excited. Go ahead and get registered. You get a discount if you register in a group of 10. And you also get 50% off your CSM registration if you register for NSC, which is huge. If you got any questions, send them into APTA. All right, let's get back to the show. All right, so I said I wanted to talk about TikTok. Christina, I've spent all day watching your TikToks. They are gold, and they're absolutely what I needed. There's one that I think might be my favorite, and it's where you talk about exactly what you just mentioned before we went to the break, which is plenty of fat people don't have pain. And just because you're fat doesn't mean that either you need to be in pain or that you deserve to be in pain. So can you talk a little bit about just being on social media, talking about quote unquote uncomfortable topics? And do you ever get uncomfortable talking about those things? Are you pretty well able to kind of push back people's ideas of what's taboo and provide the information that you know your audience needs?
Yeah, it's a good question. So I have a lot of practice talking about awkward things on the internet.
Okay.
I wrote a sex column when I was in college, so that really did me a solid in terms of being used to whatever the internet kind of throws at me. it was great. I'm glad I did it. And also those skills translate very well into what I do for a living now,
Sure.
Which is hilarious because I had no idea that was how it was all going to work out. And then I had a pelvic surgery when I was in PT school. And so I wrote about and talked about my own vagina on the internet, to be honest with you, and what I had experienced, what it felt like, what it was like navigating the medical system. And so all of that really made it a lot easier to manage Instagram. I will say the amount of feedback I'm getting is increasing all of the time. And I just hit 10,000 followers, which is also not something I ever thought would be happening in my life. So that comes with a whole new set of challenges in terms of like trolls and people that are not necessarily my people. I will say, and I know we kind of talked about that earlier. It's like, I just can't believe the things that people will say on the internet.
Right.
And, okay. It's like bonkers. Not okay. That being said, I also have a whole bunch of privilege because I am a white lady and I like fit. I wear straight sizes and fit some Western beauty ideals, right? So I think I actually get less crap than a lot of people who would talk about the same thing would on the internet. So I really like it. It's been great. TikTok's been really interesting. It's nice for me it's a way to be a little bit sassy in a structured and like culturally appropriate way. It's a way that like using some of the foul language and stuff that TikTok has in the audios has been really good for my soul. Yeah, it's really good.
Right. I would highly recommend everyone go check out Christina's TikTok and Instagram Reels, which is a new feature. Basically, it's the Instagram version of TikTok. And I think they're really great. Honestly, they make me feel a lot more comfortable bringing up certain things because, like Christina said, talking about like foul language and more of like a Gen Z type environment. I think it's been, for me, really great to watch those and feel a little bit more affirmed in kind of what I'm feeling, but then also the fact that I still deserve to feel better as a PT patient myself. I do have a question for you too about one of your Instagram Reels in particular. You mentioned providing affirming and trauma-informed care. I think you've got an Instagram highlight on that as well. So just for those of us who don't know what that means, could you explain that and what sort of training you went through?
Yeah. So trauma-informed care, basically the thing that is most foundational to trauma-informed care is recognizing how ubiquitous trauma is. So how far-reaching it is, how many people it affects, and then doing everything you can to not unintentionally trigger someone in an interaction. And so in terms of training, I have just been seeking out a ton of information about it. I've listened to a bunch of webinars. I kind of go outside of the physical therapy practice in more like people who are providing behavioral health services primarily because they do a lot of, and actually teachers and guidance counselors talk a lot about providing trauma-informed services, trauma-informed teaching, et cetera. And I've recognized like in my own journey with the medical system, it made things make a lot more sense for me. So when I had that pelvic surgery, I underwent medical trauma, and I knew that having these big sympathetic nervous system reactions to things that I absolutely could not control, even though my rational brain was like, this is not an appropriate response to what is happening in this moment. So once I started learning about trauma-informed care, it was like, oh, now I totally understand what was happening. And I really don't want to do this to other people unintentionally. And so how can I avoid that? That being said, there's not a lot about it in the physical therapy profession. There's not nearly enough about it, in my opinion, in pelvic health. And so that's like on my to-do list of things I would like to do would be to start teaching people about trauma-informed care and how I manage it in the clinic.
Yeah, absolutely. And this is a question for both of you. Are there any trainings, any resources, like books, podcasts, et cetera, that you would want to recommend to the audience? Something that came to mind just now when you were talking, Christina, is the book, The Body Keeps the Score. Have either of y'all read that by chance? It's a lot.
Quarters of the way through it.
Okay. Yeah. So for me, like it really hits home personally, and it's a lot about kind of trauma and how that presents in the body, and sort of physical symptoms that a person might have, which I think is just so salient for our profession. But is there anything else that you've seen, whether inside of our profession or outside, that you think could help the students, new grads, and everyone else listening in today?
I would love to hear Ivana's take from all of the yoga stuff and things that you do.
Yeah. So one of the things that we learn about trauma is when you are relating it to in the animal world, and it's something that I never really noticed, and now I can't unsee it. But when, for instance, if a gazelle is at a watering hole and drinking, and a lion were to run up behind the gazelle and attack the gazelle makes it, don't panic, gazelle makes it, it's safe, it runs off. And the first thing that the animal does when it's safe is it shakes. It just shakes its body, head to toe, shakes everything, and moves on. And the reason being is it lets go of what just happened. And it has to let go of what just happened to move on to something else. And we don't do that physically or mentally, emotionally. We don't do that. And so we hold on to that. And one of the things that we learned for yoga therapy is releasing that. And I don't know if you've noticed it doing pelvic. I've noticed it more doing pelvic or even just any type of like skin manipulation, even on ortho. You can start doing something on somebody, a post-surgical scar or anything like that, and they will just start weeping and have no idea why, and or laughing, or something will just overtake them, and they can't fully explain it, but it's because you're shaking, you're letting go of what trauma you've been holding in that section of your body for this entire time, and you didn't know how to get rid of it. And so I think that teaching somebody that, yes, you went through this, and yes, you experienced something, and that is completely valid and fair. Now we have to, this is how we move on. And it's not belittling what you went through, and it's not belittling what you're feeling, but this is how we recognize it, this is how we accept it, and this is how we move forward. And I agree with you. I was born with a uterine condition, and I've had, I don't know, 5 or 6 laparoscopic procedures throughout my life. And it's something that I have to deal with every single day. And I didn't ask for this, and I didn't, buy it on Amazon and then be upset it didn't come in the way that I liked it. It's just a card that was dealt to me. But when I found out about it, I was 16. Like, how do you have surgery at 16 and have all of these things happening to you and know how to handle that? You don't. Right. Nobody does. So, learning how to shake off what just happened to you and be able to move on and move forward and not hold on to it any longer is, I think, something that we can all find our lingo to do and to provide to our people.
Yeah. Best sayings. You have the best sayings about,
what is it?
You have the best sayings. I didn't buy it on Amazon. It's not like it just came in the wrong color. It just, it makes me laugh. So
you can't send it back. It's not a choice that you made, and you shouldn't feel bad about it because it's just something that happened.
Yeah.
They should put Ivana quotes on Pinterest. That's going to be like my whole Pinterest face. It's just your face. I love that. There's actually a book called Why Zebras Don't Get Ulcers. And it's that same idea of they either make it or they don't. And that's kind of it. They don't hold on to it. They don't ruminate. And that's such a cool story that like gazelles literally shake it off and then they move on. And of course, as humans, like it's,
Yeah, you picked up a dog in the shelter and it bonded you. It didn't hold on to what just happened to it. It moved on. And
there's a physiological part of that.
Right.
So Emily Nagoski and Amelia Nagoski, they're sisters. And actually, when I think about books and things that I recommend all the time, Emily Nagoski's book is called Come As You Are. And I just think everyone should read it. It really explains so much about sexuality, especially for sexuality in folks who are estrogen dominant. And so I think that is just such a good book. And so they are sisters, and they wrote a book called Burnout. And they talk about the stress response cycle, and they talk all the time about how physical activity and exercise is such a crucial, critical part of completing a stress response cycle. Because we don't get to run away from our boss yelling at us. We don't get to run away from the pandemic. So, but you can treat the stress without treating the stressor. So you can continue to complete the stress response and let it go from your body, even if the stressor, the thing that's causing that stress, continues on.
Yeah, that is so cool. And two, I took a stress physiology class, now that we're talking about this, in my master's program. And one other thing I learned too about the physiology of stress is that based on like hormones that either go up or down during the stress response, once that stressor is gone, the first thing that your body needs, one of the first things, is food and energy, restoration and eating. And I feel like that also can be so tricky. So like to be very open and share, like, I have an eating disorder. And so for me, like, not only is that a stressor, but I also then have a very difficult time nourishing my body to then complete, like you said, that stress cycle, so that you can move on from that. So wow, very cool. I'm learning a lot about stress physiology. It takes me back to my master's days. So you've both been so open about kind of your own experiences. I would love to hear too, like, how do you manage your own mental health while also trying to care for your patients? What do you do to to deal with it? And actually, it makes me laugh because a lot of times people are like, "Oh, just do yoga," but it's like, Ivana, for you, maybe that actually really is helpful. So I would love to hear more about your own like self-care routines and how you take care of yourself.
Yeah, so first and foremost, you gotta get some dog cuddles. I feel like
Yes.
I'm just a new person after I cuddle a four-legged animal. Honestly, to be just, completely frank, I love yoga, obviously. I've dedicated a pretty hefty chunk of my life to it. But the most difficult part of yoga for me is the stillness. And that's one of the things that I spend a pretty decent amount of time at the end of any type of yoga class, before leading into Shavasana, because honestly, it's the hardest pose. You can stand on your head, you can curl yourself up into a pretzel, and that's all fine and dandy. But for me, and I think that for a lot of people, that is honestly the hardest pose. And it's one that I had to work a very long time at. And I mean, it even, hundreds and hundreds and hundreds of hours of yoga teacher training, and I would just dread it, just absolutely dread that moment. And I didn't care what else we did. But being still and being alone with myself and my thoughts was something that was really terrifying to me. And it's just one of those things, the bringing it back to yoga, the pose you hate the most is the one you need the most. And just like any of our patients, exercise you hate the most, it's the one you need the most. And that's why you hate it. And so finding for me, any type of, for anybody else, it could be like, painting or running or, any other meditation or singing or whatever it is that gives you a second to kind of be alone with yourself and be honest, be honest with yourself and, why do I feel the way that I feel and what am I going to do about it? And it's okay that I feel that way. And I'm okay for feeling that way, but now what am I going to do? And being still is not, it's not easy. So
no, it's not.
Working.
Yeah. Thank you for sharing that. Christina, is there anything that you do in particular to take care of yourself while taking care of others?
Well, now I'm just thinking about how I need to spend more time running towards stillness and stop using being busy to run away from my own stuff. So thanks again for that, Ivana. That's me up at night, I have no doubt. Typically, I spend a lot of time just reflecting in terms of, and like what Ivana said, in terms of being honest and allowing myself, because I think we spend a lot of time pushing down feelings, especially, I think a lot of the time, especially in pelvic health, actually, because I think there's this narrative that if you get too close to your patients, it's a problem with your boundaries. So if your patients' stories and hardship and trauma are impacting you, it's a problem with you and your boundaries, not a problem with like really anything else. The problem with that is that it doesn't allow you to grieve, and it doesn't allow you to process through the things that are coming up for you. So I try and give myself a lot of time to do that. I was actually listening to a talk yesterday about sudden loss and grief, and trauma that can be associated with that. And right now we're going through this time where we are all, I think collectively are grieving something. We're kind of like grieving. Honestly, there are a lot of things we could be grieving. And to not talk about it and to not leave space somewhere in our lives doesn't help us move through it. It keeps us stuck. And so for me, a lot of it is just being open about the things that I feel. And I am open with my patients, and I don't make it about me. And there's a way to do it. It can be therapeutic, and a way to do it is not. But right now, a lot of people are in a lot of pain physically and emotionally. And sometimes it's really hard to differentiate which is which. And so I just tell people, like, look, we are living in this very trying and challenging time. And I just want to be honest and validate, like, that your feelings about this are normal. And then I try and do the same thing for myself.
Sure. Yeah, absolutely. So both of you brought up a lot of like self-reflection, kind of being still with yourself, looking inwards, and then being able to serve other people by doing that. So I think that's really great. So going into a couple of questions, again, that came in from my Instagram community, I was wondering, do you have any tips for students or new grads on maybe things to avoid so as not to maybe worsen a person's body image, how they see themselves, or how they see their potential for recovery? So things like, not to answer the question myself, but things like microaggressions and racism, or using the wrong pronouns or refusing to use the right pronouns, things like that. Anything that you can think of in our language or our body language that we should maybe be more attentive to?
I think a lot talking about weight is really important, and it does come up a lot, especially in the healthcare field. And even if you're not directly bringing it up, I will almost guarantee you that some medical provider at some point has made a patient who is a fat patient, has made them feel bad about being fat. And they're going to bring that into every encounter. That will dissuade lots and lots of people from getting care in the first place. It's just an awful idea that people don't seek the care that they need and deserve because they're afraid that they're going to be put down, discriminated against, made to feel shameful, which are similar to the reasons that we also want to avoid microaggressions and racism, right? Same. Yeah. So, and using the wrong pronouns. So I think just being really aware of that, and also being very aware of the privilege you bring into a situation, one from your provider in the first place, and then also the body that you hold, what privilege do you bring in with you because of that alone, and being honest with yourself about that, and being willing to be honest with a patient about that too, if it comes up.
Yeah. Can I ask you a follow-up on that? So if a patient does come in and say like, oh, so-and-so told me this, and this is how I feel now about my body, like, how do you undo and help patients unlearn some of that messaging without, saying anything that might step on the toes of another provider or might put another provider down?
Right, without throwing someone else under the bus. Right. That is a good question. And it's something that I sometimes very much struggle with, because I get very mad at other providers using big language and making my patients feel anything other than as wonderful as Ivana has told us all that we are. So right. I will just say what I know. I try to then stick to the facts. I'm like, I have not read any research that suggests that thing is true. And in fact, what I know clinically, what I've seen it throughout my patients, is that this other thing is true. So, and I try and reframe it in terms of that. I will say, I bring everything back to the nervous system all the time. So I'll say like, because we could absolutely talk about how increased adipose tissue can be inflammatory, right? And so I'm happy, that's a fact. And I am very comfortable talking about that. And I will tell people, that can be a contributor to a nervous system that is going to give you pain as the output. But it's most of the time not the primary driver. And so we need to find out what the primary driver is so we can treat that. And we can treat all these other things, change all these other things that can change your symptoms regardless of whether or not the amount of adipose tissue you have changes.
I love that.
Yeah, it's never kosher to throw another medical provider under the bus. And so typically, just personally, I kind of am like, well, I don't know. I kind of am just like, oh, well, I don't know exactly what they meant by that, but maybe what they meant was this, because this is how this works. Or maybe they meant to say this because this is how this is. And so, not necessarily saying, well, like, yeah, no, they're wrong, but showing them, well, like, this is how this works. So maybe they just misspoke because, this is how this is, and this is what we're going to do. And then giving them the opportunity while you're in physical therapy to show how what you will do will benefit the issue that they're having. And so, that's your time to shine. It's not they're not in that office anymore. They're not in that other with that other clinician anymore. Now it's your time to show them what you can do to help.
Yeah, absolutely. And I think that gets into one of the last questions I have here too is, this is pretty vague, but if you could just talk a little bit about being a person who is for like body acceptance and positivity and professionalism, how our view and practice of professionalism within our profession has changed over time. And that can look like anything, honestly, the way you communicate with your patients, the way you are online. Is there anything that comes to mind on that topic for you?
I mean, TikTok has like really pushed my boundaries on professionalism for sure. Before I was very hesitant to like, I don't know. I had these ideas about what I should look like, how I should dress, how I should speak about things, that I should never be negative, that I should never use foul language, which is sort of funny because in my personal life, I don't hold any of those ideas. And so once I had that sort of like culturally appropriate, like the cultural check mark of you can be sassy and, use language that you wouldn't necessarily use in the clinic, and you can wear whatever you want. That totally changed the way that I talk about pelvic floor physical therapy in general. I was afraid it would put people off, but I think if anything, it's made it way more accessible to people, which has been really awesome. Like, I think that's why my engagement has grown, is because I'm not doing anything different in terms of the things that I'm talking about. I'm talking about the same stuff. I'm just talking about it in a way that is a little bit edgier in regards to professionalism. And when people are coming in and talking to you about painful sex and peeing their pants and things like that, they want to know that you're a human being. So yeah, it's changed a lot for me.
Yeah. And I've seen too in the comments under your post too, people asking you so many different questions, people asking you where you are so they can come see you too, and you be their provider. So I definitely think that you are absolutely exceeding that goal of making it more accessible and making it so that people, I've seen a lot of people say like, oh my gosh, I had no clue on like XYZ subject. And I just love seeing that online. Ivana, anything to add about professionalism? I know that like the clinic I was in with you, everybody's pretty goofy and patients really love that. So is there anything for you that you feel like has changed over the years? Any advice you'd want to give anyone?
I remember when I was in school, during practicals with my mock patient, and specifically remembering my director behind me saying, you wouldn't actually say that to a patient, would you? Yeah, I probably would. There's certain subjects that I don't, there's certain subjects that I just don't hit in the clinic. We're not going to talk about religion. We're not really going to talk about politics. There's things that I want to engage with you. If you'd like to speak about them, then okay. But there are certain things that I'm just not going to engage in for the sake of, again, this is a safe space for anybody that walks in, and I don't want to make anybody feel uncomfortable. But yeah, just like you said, I'm a human, and you're coming to me in a very vulnerable state, and you're coming to me feeling a little insecure, and you're coming to me with some pain, and you don't want a robot. You want to know that you can, shoot the shit with me, and you can joke with me, and I can joke with you. And when I want to build that rapport with you, because this is who I am as a person, but at the same time, I'm going to push you. And I feel like if we don't have that rapport, then when I tell you that squat was crap and you can do better than that, you're not going to want to do that. So, you know, we're stuck together for quite some time, and we're with you for several weeks at a time. And so let's just make the best of it. And I'm not good at being fake, and I don't want to be fake with you because I need you to be honest with me. So here I am. Take it or leave it.
I love that. All right. Last question I've got for both of you before we sign off for the night is if you could go back and give your student self one piece of advice, it can be on the topic of body image or not, what would that be?
You really do know more than you think you know. And the thing that is going to change things for your patient isn't how much you know in the first place, it's how much you care.
I love it.
Mm-hmm. Be confident. Just be confident.
Love it. Awesome. Well, unfortunately, we are out of time. Honestly, I feel like I could talk to y'all all night about this stuff. But if people want to keep the conversation going, where can they find you? How do they reach out?
Yeah, Instagram is by far the best way to reach out to me. I'm on TikTok, but I really mostly use it for content creation. So please don't send me DMs there. It's a scary place. But my Instagram handle is my name, Christina, KRYSTYNA.Holland. And then you could also email me if that's better for you, Christina at inclusivecarellc.com.
All right.
Yeah, my Instagram is Ivana Salazar, all lowercase, IVANA SALAZAR. Feel free to shoot me a follow and be bombarded with pictures of my dog.
I am really afraid of dogs, and I love Ivana's dogs. Very, very cute dog.
I know.
So,
yeah, it's cute to love her.
That's also true. Highly recommend following both of these wonderful human beings. Thank you both so much for being here tonight. Seriously, it just means the world to me, and I know it means a lot to the audience as well. So really, really appreciate it. And thank you to everyone who joined in tonight. Take care and be safe. See y'all next time.